Hi all, my name is Brooke and I'm the Engagement and Partnership Lead here at Better Health Company and also a health coach into our online programs. In this presentation, you'll be learning about the Think, Eat and Move program, what it involves, the outcomes we have seen and how you can refer or sign up. So firstly, the brains behind the program, Better Health Company. Better Health Company is essentially a health promoting organisation. So we're a team of very passionate and dedicated health professionals who work to combine best available evidence with clinical and community-based health professional expertise. We design, develop and deliver world-leading services in the health space. Better Health Company houses a range of different programs and services, which are all tailored to different demographics. Our main aim is to really help people live long, healthy, and happy lives and to reduce the incidence of preventable chronic diseases in the community and in the nation. So everything we do is supported by published literature and aligns with relevant national guidelines. Our research and advisory team conducts research to assess the impact of our services, and we are continuously collecting data to evaluate our programs. Continuous improvement is really at the forefront of our business, and we rely on stakeholder and consumer engagement as this is a really integral part of this. So what is Think, Eat and Move and how does it work? So the Think, Eat and Move program is an online healthy lifestyle program for adolescents aged 13 to 17 years and their parent or carer. So the program is evidence-based and has been designed by health psychologists, dietitians and exercise professionals. It aligns with the current Australian government guidelines and utilises behaviour change strategies that we know are effective. So the program runs for 8 weeks and adolescents and families go through a range of different topics based around physical activity, healthy eating, screen time, and mindfulness. And with the program being delivered online, one of the key strengths is the flexibility and privacy it offers our adolescents and their parents or carers. Being able to do the entire program at home and in their own time means that they have a lot of autonomy with the program, and it does provide a real sense of independence and responsibility over their own health. So how does it work? So as I mentioned, it is an 8-week long program, and each week adolescents along with their parent or carer complete a 30-minute online module, which is delivered through our website, and a 30-minute one-on-one health coaching call with a qualified health professional. So to promote and encourage the healthy lifestyle topics explored in our online modules, participants receive weekly targets or sort of like mini goals, practical resources and incentives, SMS and email support, all of these being a really critical part of the program, which I'll sort of discuss each component in further detail. Now, the online activity sessions each take around 20 to 30 minutes to complete, and each session does focus on a different subject. So the topics covered throughout the 8 weeks include things like the 5 food groups, serving sizes and portion sizes, physical activity, screen time. We talk about fats and sugars, and we really go into label reading and also how to manage tricky situations. So we really try to make health information that can be quite confusing, really simple, and deliver it in bite-sized chunks. The sessions are narrated and include lots of interactive activities and games to actively engage participants in the learning. When designing the sessions, the team were really focused on making them easy to complete, fun, and really practical for adolescents. And so they largely focus on skill building to equip adolescents with strategies that they can use in their everyday life. Now, the one-on-one phone calls with our qualified health coaches are probably the most influential component of the program. So the purpose of these calls are to really support, praise, encourage, and action plan with participants. So many adolescents do tell us that the coaching calls are the best part of the program, as it does keep them really accountable for implementing and sticking to some changes that they're working on. So the calls are structured and loosely scripted. So they were developed by a health psychologist and include the elements of cognitive behavioral therapy and also motivational interviewing techniques. And our coaching approach aims to really help empower adolescents to problem solve and make changes in a way that really works for them, sort of rather than telling them what to do. Coaches will also speak with the participants' parent or carer each week, just to really help upskill them to support their adolescent. We have a real flexible approach to the parents' participation in the coaching calls, and sort of we'll talk to the family at the start of the program about what will work best for them. For younger participants, for example, the adolescent and the parent might go through the call together. And then for older adolescents and those who do prefer to be a bit more independent, the coach will usually spend most of their time talking one-on-one with the participant directly, and then they'll speak to their parent or carer sort of separately for the 5 to 10 minutes at the end of the call. And in those cases, the two conversations are independent and confidential, so that both sort of the participant and the parent or carer can talk about their challenges in sort of a safe and private environment. Here we've got the resources that are provided to participants on the program. So they do receive 2 resource packs at various stages of the program, really to help support and engage them in the program. Resources include a handouts magazine, drink bottle, there's a recipe book, a portion cup, there's some nutrition resources, and they also actually get a Garmin Vivo fitness tracker, which is a particularly good incentive for adolescents when they're getting started with the program. A lot of them get really, really excited, and it does help for them to stay motivated and on track. We also send regular SMS reminders to the participants and also to the parent or carer throughout the program. This is just to update them when new sessions become available, and also to remind them of their coaching appointment times and also some of their targets that they're working on for the week. I'd like to stress that we don't deliver any new information via SMS. They're really just prompts and reminders to keep participants on track. Now, the program approach is really positive and supportive. We're very much focused on helping families to create healthy habits that they'll be able to maintain well after the program ends. Like I've mentioned, all of the program advice is aligned with the Australian Dietary Guidelines and the Physical Activity Guidelines. And through the program, we're really trying to equip participants with practical skills and the knowledge to make informed decisions. It's not an overly prescriptive program, so some families often expect to have meal plans and things like that. Instead, we're trying to encourage adolescents and families to consider a wide range of options for how they can include, say, more fruits and vegetables in their diet and be more active, and then for them to work out which of those options will work best for them. Now, although the Think Eat and Move program is directed to adolescents, parents and carers do play a really important role in supporting them through the program and obviously into the future. We view parental involvement as a further aid to support positive behaviour change throughout the program. Generally speaking, parents are usually responsible for food shopping and decide on what's available at home. They're often preparing at least one family meal most days, and in some families, they're packing school lunches for the day as well. And even when adolescents are making their own food choices, parents and carers are still role models for their children. And so if we can support them to role model healthy behaviours, that can have a real positive impact too. And that does extend beyond nutrition. We talk to parents about healthy role modeling for eating habits, physical activity habits, and also their own attitude towards health and body image as well. Now, to continuously improve and evaluate our programs, extensive pre and post program measurements are collected from all participants completing the program. Now, this program measures nutritional intake, physical activity, sedentary behaviours, healthy lifestyle behaviours, and it also assesses knowledge, confidence, and skills in key areas. We provide detailed instructions and resources to all families just to support families to take these measurements accurately at home. Now, current evaluation on our latest cumulative report in December 2022 shows significant outcomes have been achieved. So we have seen a reduction in BMI average, an average increase of time spent being active, and a reduction in the time spent on screens. We've also seen an improvement in self-esteem, and we measure this by the Rosenberg self-esteem scale. And we also see improvements in their overall nutrition score. So this is based on a 28-point scale. So on average, we have observed an average of 9.7 decrease in BMI after the 8-week program and an average 2.3 point improvement in the Rosenberg self-esteem scale. 49% of participants increased their fruit intake post-program, 64% increased their vegetable intake, and 43% of participants improved their water consumption. We've also observed statistical significant improvements in the cohort with regard to screen time, as well as consumption of confectionery, sugary drinks, takeaway foods, and also fried potato. And one of the best improvements we saw was that 71% of participants increased the number of days that are met at the National Physical Activity Guidelines each week. Adolescents and families are also asked to rate various components of the program on a 5-point scale from strongly agree to strongly disagree. In the weekly coaching calls the participants complete, we consistently hear positive feedback about how the program is helping them. At the end of the program, we do ask them to fill in a feedback survey, and results from the feedback survey are shown on screen. As you can see, most adolescents agree or strongly agree that the online sessions were engaging, that the coaching helped them stay motivated, and that they made some changes to their physical activity habits and also their eating habits. Now, the Think, Eat and Move program is currently funded in Central and Eastern Sydney with thanks to funding provided by the Central and Eastern Sydney Primary Health Network. Now, the eligibility criteria for participants to be eligible for this funded stream requires them to be aged 13 to 17 years, and they need to be living, studying, or either seeing a health professional within that Central and Eastern Sydney area. Plus one or more of the following. So they do need to be classified either as above a healthy weight or diagnosed with a chronic health condition. So things like depression, anxiety, diabetes, heart disease, kidney disease, or if they are deemed to be at risk of diet and lifestyle related diseases. So if you're an organisation who would be interested in discussing options for the Think, Eat and Move to be rolled out in your community or workplace, please just get in touch with us via email. More than happy to hear from you and sort of help work out how we can implement Think, Eat and Move in your area. In regards to how to refer or either how to sign up, we do accept both self-referrals and health professional referrals to the program. So adolescents and families can register by going directly to the program website and there's a simple sign up button. They can also call the Better Health Company directly. Health professionals can refer patients to the program via our interactive referral form on the website or over the phone. They can do it via fax or via email. Once a participant's details are sort of entered or sent through, our Better Health team will contact them directly to discuss their registration. Now, finally, we are looking to provide access to the program for as many adolescents as possible. So if you work with an adolescent who you think would benefit from the program, we'd love to share some resources, information, or contact details with you or with them. And if you require any additional information about the program, please don't hesitate to get in touch further, as we're super happy to help as much as we can. So thanks for listening today.